Thank you for watching this video. Please subscribe to my YouTube channel and follow my Facebook page. Please also support my work on Patreon and Kickstarter. It will be greatly appreciated. I think this is the first one. So Jess, you have to come in and tell us what A, B, and C is. Body. Yep. Spinal canal or vertebral foramen. C would be the transverse process. Correct. Correct. Good job. All right. Let's keep going. Correct. And got there. All right. What joint is that? That is a facet joint. Correct. Is it a superior facet joint or an inferior facet joint? Yes, correct. That's good. That was a trick. That was a trick question, and you got it right. You got it right. All right, fantastic. Okay, so these are the ligaments. That one needs to be here, the other needs to be here, and the third needs to be here. Correct. And yep, B would be the anterior. I actually can't. I actually can't hear anything. No, none at all. Absolutely. Flavum, you are correct. All right, done. And yep, these are two joints. That's one joint, that's the other joint. Costovertebral joint, correct. Costotransvere joint. Correct. Yep, good job. All right. Let's keep doing this. That's the Costochondral joint, yep. Yep. Yep, the shaft of the rib. Yep, or the angle of the rib also. Okay, let's go down. Yep. It's a joint again. Yep, it's the Costotransvere joint. Yes. Yes. So that's the rib and that's the transverse process. Correct. All right. And that one. Again, it's a joint. Yes, it's the costovertebral joint. Correct. Correct. All right. And yep. Correct. It is the costal groove. That is the costal groove. And I did not show it to you in that angle, but I'm glad you picked it up. I forgot to demonstrate like that. But yep, that's the costal groove. Correct. All right. Let me fix D for you. A would be the Manubrium. Sternal Angle of Louis. How do you spell that? L-O-U-I-S, is it? No, there it is. There it is. It's corrected, yes. And yep, body of sternum. Xyphoid process. Correct. Typhoid process. Anyway. I think it's the same thing. But let me check. Let me check. You mean I'm not one for academic. Ziffy sternum. Is that how you spell it? Ziffy sternum. Yeah, it is a xyphoid process. Yeah. Everybody's like pointing there. I think it's the same thing. I wish I knew this. I'm not much of a proper academic. I don't have correct answers for those things, such things. But nonetheless. Inferior angle of the scapula. Correct. And that's correct. Now let's keep going. These are the sort of fossine surfaces of the scapula, and these are the borders of the scapula. Correct. It is. Infraspinous fossa. Correct. Spine of the scapula. Correct. D would be the supraspinous fossa. Correct. Correct. It's the medial border. Correct. I think it is the lateral border. No. No, it's not high enough. No. We're getting there. You will see those. There you go. Well, it's not exactly. But that's something of the scapula. What is that? Correct. Good job. And this one? Yeah, the head of the humerus. Humerus. Yeah, I can't fix that now. B would be the acromion, yes. Correct. Nope. Nope. It's a bit. Correct. Clavicle. Correct. That's the acromioclavicular joint. Clavicular joint. Yep. The acromion end of the clavicle. Yep. Correct. Well done. Muscles. All right. Let's see what you've got here. Yeah, those are the intercostals. Because you can't tell them. The intercostal muscles. Correct. Pec major. Pec minor. Correct. Correct. Correct, correct. Good job. And, yep, let's keep going. That is the lat dorsi. Well done. Correct, correct. That is absolutely lat dorsi. All right. I'm not even sure what I'm doing with that one, but It could be, I think. If I that is the place where the rhomboids would be, absolutely. Yep, they would attach to the medial border. Correct. Correct. That would be the rhomboids. Correct. 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 That is fantastic. And these are muscles of the rotator cuff. That is subscapularis. Correct. Supraspinatus. Correct. Supraspinatus. Absolutely. It is infraspinatus. Absolutely. Infraspinatus. Correct. B would be teres minor. Correct. Good job. And this one. It's the same as that one. I just, oops. Sorry, I shouldn't confuse you. What am I doing? Trapezius. Trapezius. Correct. Well done. Did we miss any? I don't think we did. And let's do this. Identify the pathology here. Yep, fractured rib. Good job. I think it's fractured up there also, but that looks like near this. Yep. And I said, look at that. What is that? I think that's a hematoma. That's blood. That's actually. That. All right. And lung tissue has been collapsed there. All right. Identify the pathology here. Correct. Correct. And why is the heart so much on this side? Correct. Tension pneumothorax. Absolutely. It's a fracture causing and another fracture causing a pneumothorax and becoming a tension pneumothorax. Correct. And what's this sort of thing like this thing here and a little bit here maybe also, but at least here. Could be. I think it's blood. I think it's blood, but could really be anything. But it's fluid. So you got it. And fantastic. Good job. All right. Well done. Okay. I think it's the same thing. I'm still stuck on rib fracture. I think we should move on from rib fracture. You can clearly see that. You can see it's right. You can see a bit of the spine of the thorax is also fractured there. So, spine of the vertebra. I'm sorry. Let's just move on. Okay. Identify the pathology. Could be a compression fracture. Well, the fracture is there. Yep. There is a fracture there. And it is a thoracic vertebra because you can see the spinous process going down like that. Could be lower thoracic, or could actually even be cervical because they've got spinous processes. But you can see that the line is not aligned properly. And so that's what you would look for. And then that compression fracture is quite clear. So it's a vertebral fracture. All right, good job. Let's look at the next one. Now, what is that? Well, it says what it is. It's fracture dislocation. But you can clearly yeah, it's out of position, and there's a small fracture there, and so this is a fairly big dislocation, and so that's the sort of thing you'd be looking for. That'd be very painful, and that person, I mean, the spinal cord could be severed there. As it says in the image, haha. Identify the pathology. Now, where is the pathology? Have a look. Yeah, mid-thoracic. I think that could be a compression. What do I have here? Compression fracture of the vertebra. So you said there's a fracture. But yeah, the person does seem a bit older because the intervertebral discs are now getting smaller. All right, let's keep going. Mainly here, actually. Just have a look here. Or have a look there. Yeah. And a bit of it there.
Like, again, vertebral body fracture.
Correct.
But I wonder if in the last one, is that like a, is that showing like a loss of bone density or
I actually a bit I kind of forget what this is, but it could be a compression fracture because of a metastases, and metastases can lead to bone destruction and cause. And so I think maybe they're showing that that's the metastases there.
Yeah, right.
All right, let's keep going. Okay, now here these are lymph nodes. So what you have to figure out that what lymph nodes are these?
So I can see the trachea.
Yeah.
Obviously anteriorly. So would they be just paratracheal or are they not?
No, not close enough to be paratracheal.
Not close enough. So maybe just
Lower
lower
cervical.
cervical.
No, I would say lower cervical. I could have had that. These are, well, you can see a bit of the lung here. So yeah, lower cervical, I would have considered that correct, because supraclavicular and lower cervical sort of blend in, but that can be considered lower cervical. That could be supraclavicular, but you know you're in the right place. That's fine. I wouldn't. So lower cervical and supraclavicular are both fine. All right. So where would these lymph nodes be? Yeah, it is getting. No, these are again these parat. Look, I think that's the Yeah, the clavicle is here. These are more supraclavicular. Yeah, you can see the first rib also. So these are definitely supraclavicular here. Yep. All right, let's keep going. And the lymph nodes, I'm not sure if you can see them. Oh, now you can see them, that I'm pointing them out to you. Lots of lymph nodes around this area. You can see the lymph nodes here, 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 here. Multiple lymph node groups enlarged. Oh, some are supraclavicular. Absolutely. They're supraclavicular enlargement. No, this is higher up in. Yeah, anterior cervical would be correct. These are higher up. What are these ones? Yeah, no, almost. What is subclavicular lymph nodes? There are lymph nodes in that area, but what would you call them? The, Axillary. Apical of the axillary would be subclavicular, yes. So those are axillary lymph nodes. Yep. So yeah, so you got axillary here, you've got supraclavicular here, lower cervical, upper cervical. So there are lots of lymph nodes here. So it's a lymphoma with multiple neck lymph nodes. All right, let's check out another one. This is big. I couldn't get better images. Where would this be? Yeah, or lower cervical. I mean, again, I wouldn't make it. Supraclavicular and lower cervical are fine. That's fine. Okay, let's go to the next one. Where is the pathology? Identify the pathology. No, I forget. I think it's these ones. I think these are the enlarged lymph nodes here. Pre-aortic, correct. Prevascular, which are pre-aortic, correct.
Prevascular.
The same. Prevascular and pre-aortic are the same group. Correct. All right. What's the next one? Now here you can see there's lymph nodes here and here and here and here, maybe here and here. And again, I'm not looking for some definite answer, as long as you understand where it is and
Roughly where we are.
yeah.
So maybe two could be pretracheal.
True could be pretracheal.
Three might be prevascular.
Yep, I agree. Let's see, prevascular and paratracheal. Yep, that's fine. That's good. Very good. All right, let's keep going. Now, take your time and orient yourself to where these structures are. And but what I am confident, because I've not only taught you but I've quizzed you, you know where in the heart these areas are now. So I'll wait for you to, you know, they're in different parts, and just take your time.
Okay, so I think that first image on the left, probably segmental.
Yeah, lobar, absolutely segment.
Probably segmental.
Could be segmental, could be lobar. Could it be hilar, like a bit distant for high?
Yeah. Yeah. This looks a little bit smaller, maybe.
Sure,
Branched down a bit.
I agree. All right.
But yeah, I guess you wouldn't really know.
No, no, but fair enough. But you're in the right place. So you know your stuff for that one. Good.
The second one's a little bit harder, so I'm looking at what I think is. I think it's the arch of the aorta on the right.
Yeah,
Oh,
I
sorry, hang on.
this one.
Yeah.
Yeah, yeah, I believe so. That looks like the arch of the aorta, and this looks like a.
I think it's paratracheal.
Yeah, I think that could be paratracheal. I would say paratracheal is
Sorry,
appropriate for
yeah.
that.
Can I ask what the other white structure is?
This one, I think that's the brachiocephalic vein coming into the left one, coming into the right one.
Yeah.
Yep.
The third one. So again, you're sort of at the pulmonary trunk, which makes
Correct.
it hilar.
Yeah, I mean that could be hilar. That could be hilar, and that could be. Well, the trachea is gone now. I mean, the trachea is bifurcated, so that could be periesophageal. Yeah, 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 fair enough. Good.
Okay. And then the last one, probably hilar or lobar.
Correct.
Probably hilar actually, because you're still at the pulmonary trunk
Yeah,
there.
yeah.
And then maybe the red box is paraesophageal.
Fair enough. Good job. Good job. So what do we have? Paratracheal, hilar, periesophageal, and subcarinal. Correct. So that could be subcarinal. Yeah, subcarinal are sort of like periesophageal, just under the carina. But good job. Ah, so well done. You've gotten the idea and the concept, so that's really good. All right. So where could these be?
Okay, so I think 4R is probably paratracheal again.
Fair enough.
6, maybe prevascular.
Correct. I think paratracheal and subaortic. Subaortic is fine. Prevascular could also be fine. Subaortic, well, it is still at the level of the. It's not under the arch. Actually, I would say prevascular is more correct than subaortic. I might actually fix that. Prevascular.
I actually don't remember how you defined the subaortic. Was it?
It is under the arch of the aorta, but above the pulmonary, right pulmonary artery.
Oh, that's right. The window.
Yeah, aortic pulmonary window.
Yes.
AP window, the aortic pulmonary window. Yep. All right, let's keep going. Oopsie. Which lymph nodes are these?
Okay, so 7. You can kind of still see the primary bronchi, so maybe 7 subcarinal.
Fair enough. 7 can be subcarinal.
Yeah, or paraesophageal. And then 10, probably hilar. Oh,
Correct.
no, probably lobar.
Fair enough. I'd go hilar or lobar. Subcranial and hilar. Hilar, that's fine. Lobar is also fine. But well done. I think you got where they are. And yep, identify this one.
So 7. I don't know if you could call that or just carinal probably.
Carinal or subcarinal, absolutely.
10 is probably hilar.
Let's see. Hilar and subcarinal lymph nodes. Well done. Once again. Okay. What do you mean identify the pathology? It looks like a cancer to me. But I don't know what I'm trying to ask here. What am I trying to ask here? Lung cancer with lobar lymph nodes. Lobar lymph. Okay. Oh yeah. Oh, absolutely. Oh, I know what I'm trying to identify here. I forget what I'm doing myself. That's lung cancer. That is definitely lung cancer. But you see the lymph nodes that are enlarged here. These can be enlarged lymph nodes, and these are lobar lymph nodes, because that's a major bronchus, like a secondary bronchus. So these are lobar lymph nodes. All right. Similar to here, identify the pathology. Can you see the lung cancer?
Would it be the top, the superior lobe on the left?
Yep. And
And then
what lymph nodes are enlarged here?
yeah, so probably lobar.
No, no. It's further down than hilar. It's also further down than lobar.
So segmental maybe.
Either segmental or subsegmental, because these are segmental. These are now segmental or subsegmental bronchi.
Yeah, right. So do you kind of look at the diameter of the bronchi and then
Or yeah, or absolutely, or you can actually see the level. Let me show you again. If you look at it here, like remember when we did the where is the pulmonary window? Never mind. Hold on, let me. Oops, sorry. This is. And when we did the pulmonary, so that's your trachea, that's your bifurcation. So lobar lymph nodes. So this is about hilar area. Then here you would have lobar lymph nodes. Here you'd have lobar lymph nodes. Here you'd still have lobar lymph nodes. That would be lobar. That would still be lobar. But if you had lymph nodes here enlarged, let's say here, that'd be segmental or subsegmental. Lymph nodes enlarged, that would probably still be lobar, maybe even segmental. But when you go further, this is definitely segmental. And if it's further down, that would become subsegmental.
right. I was sort of basing it on how lateral you go, but I forget.
No, lateral is also fair. No, lateral is also fair. No, this is segmental and subsegmental on this level. And yeah, the more lateral you go.
But I guess not all the medial ones
So this
will be
the
hilar. I guess depends on the level or something.
lymph nodes around here would be lobar. Lymph nodes around here or here would be segmental or subsegmental. Does that make sense? I actually have a I actually have
Yeah, no, that makes sense.
I actually have a good image. I'll show you. It's in this presentation somewhere. It'll come. Where am I in this presentation? There, what? This is the image. So this review of lymph node groups. Now, paratracheal around here. Subcarinal will be here.
Yep.
Hilar would be here.
Yep.
And then there are actually two main lobar groups for the right lung and one main lobar group for the left lung. And how that is that in the right lung you have this first bronchus it's the secondary bronchus of the upper lobe and the bronchus intermedius. There's a lobar lymph node group there, and then when the bronchus intermedius divides to the right main bronchus and the right middle lobe and the right lower lobe bronchus, there is a lymph node group there. So these are lobar lymph node groups. In the left side, you just have one where the left main and the left lower lobe bronchus, upper and lower lobe bronchus sort of divide. And that's your lobar group for the left. But then as you go further in, then here you have segmental lymph node groups, and then further up are subsegmental lymph node groups. So this is lobar, down here would be segmental, and then there would be subsegmental. So here it'd be lobar, but up here would be segmental, and then further up would be subsegmental. So here would be lobar group, but here would be segmental groups, and then subsegmental groups, and again here segmental group and subsegmental group. So it's the way the bronchial tree expands. Cool. So we were here. So that would be segmental. You'd agree?
Right, yes, definitely.
Okay. All right. Identify this lymph node.
Right, so that would be the left atrium, the sort of big white bit.
Yes.
Is that right?
Yes, that would be the left atrium.
Yep. So, maybe just paraortic.
No, paraortic would be here. What's next to the aorta? It could be hilar, absolutely, hilar lymph nodes.
Oh, the IVC?
The IVC is not here. No, that's all right. Paraesophageal. That's where the esophagus would be. Yep, that's where the esophagus would be. All right, let's just keep going. We just saw that, so we just did that. So I'll move into the next one. Where is the pathology? What are you trying to show here? Oh, these ones, these lymph nodes. Axillary lymph nodes. Well done. All right, so these ones. There'll be axillary again, and this one. Correct. Prevascular and axillary. And these lymph nodes here. Oh no. Oh yeah. No, that's not the lymph node. That's the lymph node. Yes, yes. You can call them internal thoracic. You can call them. So internal thoracic lymph nodes. Yep. You can call them internal thoracic lymph nodes, or you can even call them parasternal lymph nodes. These are the two terms that are used interchangeable. Yes. Yes. And there's a lymph node here. You can't really see it properly, but enlarged. Yes, absolutely. A siliconoma is this one.
Are they silicon implants?
Yes, they're silicon implants, and sometimes silicons leaks, and it gets and the lymph nodes start absorbing it, and so an enlarged lymph node full of silicon is a siliconoma. Okay, let's keep going. Oops. All right, the lymph node is here. So you have to figure out what this level is first, and then. Well, I would say that. Well, I think we are starting. That is the top of the liver. Parasternal. No, not parasternal. Now we're at the lower groups. The lowest group. Haha. Cardiophrenic. Cardiophrenic lymph nodes. Yeah, that's all right. So we're getting to got to the cardiophrenic. So lymph nodes around the pericardium and around the diaphragm, cardiophrenic lymph nodes, and pelvic tumors, late stage can enlarge in cardiophrenic lymph nodes. Because lung tumors are not going to go down there. Does that sort of make sense? Tumors from here are going to come into these lymph nodes, and then they're going to go into the paratracheal lymph nodes and go up. Where are gut tumors going to go first? Let's say a bowel cancer. Yeah, yes. But what would the path be? It will first go into the liver. It will cause a secondary metastases in the liver, and then from the liver, it will go up to the supraclavicular. Because from the liver, it could go via the IVC or even through the lymphatic drainage. Yeah. So cardiophrenic lymph nodes tend to be pelvic. Do you get what I mean? Because they bypass the gut because they're not part of the gut system. And then they show their way up into this area. And so they tend to be pelvic tumors. Because there wouldn't be thoracic tumors. And so that's just something that, can be. So where do you think this is? Absolutely. Correct. Cardiophrenic lymph nodes, the pelvic tumor again. And that is the end of the session. Thank you for watching this video. Please subscribe to my YouTube channel and follow my Facebook page. Please also support my work on Patreon and Kickstarter. It will be greatly appreciated.